Can washing your hair at a beauty parlour land you in the hospital? This is what happened to a 50-year-old woman from Hyderabad last month. She suffered a stroke while getting her hair washed at a salon. Now, this wasn't a freak accident. It's happened to women before and it's called beauty parlour stroke syndrome. So, what is beauty parlour stroke syndrome? How does it happen? Who is at risk? And how do you prevent it? I'll be joined by senior neurologist Dr Sudhir Kumar in just a bit. A 50-year-old woman from Hyderabad felt dizzy, nauseous and began vomiting during her hair wash at a beauty parlour. She went to a gastroenterologist who gave her some medicines, but her symptoms did not improve and the very next day she developed a mild imbalance while walking. She was then diagnosed with beauty parlour stroke syndrome. I spoke with Dr Sudhir Kumar, senior consultant neurologist at the Apollo Hospital's Jubilee Hills in Hyderabad, who treated this patient. Listen to what he had to say.
So I saw the patient about 24 hours after her symptoms had initially started. And when I examined her in the OPD, she had mild swaying while walking, what we call cerebellar signs. And to me, it suggested that most likely she had a lack of blood flow to the back of the brain, that is cerebellum, based on her signs. And I ordered for an MRI, and MRI of the brain confirmed that she had a clot, what we call infarct, in the cerebellum. And in addition, the blood vessel that supplies blood to that part of cerebellum, what we call pica, posterior inferior cerebellar artery, that also had a clot.
But how did this happen? Dr. Sudhir says that when the woman bent her neck backwards over the edge of a sink for the hair wash, her vertebral artery, which supplies blood to the brain, was compressed. This in turn resulted in a blood clot, which cut off blood supply to the brain and caused a stroke. In addition, the 50-year-old woman also had vertebral hypoplasia, a condition in which the vertebral artery is narrow.
And one incidental finding we found was that on the opposite side, the vertebral artery is narrow, which can happen in about 10 to 20% of patients by birth. The artery in the neck, vertebral artery, can be narrow, what we call hypoplastic. Usually it doesn't cause any problems. But in this particular patient, because one was hypoplastic, so the other side was supplying the blood to both sides of brain. And then in the maneuver or in the procedure when she had this hair wash, and there they keep the neck hyperextended, the neck is bent backwards and to a side. So in that situation, possibly the vertebral artery, which was the healthy one, got further kinked, and that was the possible mechanism for her stroke, which led to the lack of blood flow to the cerebellum.
The first case of the beauty parlour stroke syndrome was reported in 1993 in the Journal of the American Medical Association. And while the syndrome is associated with women who get a hair wash, it can happen to men too. And it can also happen to people who get a neck massage or even practice yoga. But how common is it?
It can happen to men as well, including the women. So both genders can be affected. But here the mechanism is little different. In men, what can happen sometimes is that barbers always offer men after the haircut, they say, can we give you some kind of massage? So they massage the head, and after that they turn and twist the neck in a manner which creates some kind of cracking sound in the neck. And that is called as neck crack stroke. There is a term for that also. So neck crack stroke or neck cracking stroke. And that is post haircut, a barber gives a massage and turning and twisting of the neck. So that causes what is called as rupture of the vertebral artery. We should not go with the feeling that it's a common condition. If it is common, then people would have known about it. So it is not common. It is an uncommon condition, which is good for us because people need not panic that if anyone visits beauty parlor or salon or barber, they will get this. No, it is very uncommon. And so definitely, and as you mentioned, it is not only the beauty parlor and things like that, but any condition where the neck is put at a strain. And as you mentioned correctly, yoga, there are some postures like Sirshasan or what is called headstand. If someone is not well trained and then they try to do it, they can twist their necks. And we have seen some patients while playing, let's say somebody is playing and a ball hits the arteries. So we've had cases where the cricket ball or some other ball has hit the neck area and the artery has got dissected and strokes have happened. So any kind of trauma to the neck area due to any reason or any kind of unwanted extreme twisting movements of the neck can cause this.
So what are the symptoms of beauty parlour stroke syndrome? What are the signs that you should watch out for? And who is at risk of suffering from such a stroke?
So the common symptoms of this artery, vertebral and basilar artery territory strokes, is dizziness, imbalance while standing or walking, speech, the voice may be slurred, not clear, and then difficulty in swallowing. So the person, while swallowing food, they may have difficulty in swallowing, and also the one side tingling or numbness of arms and legs, and sometimes weakness of the arms and legs. So the symptoms may be similar. So anyone getting a stroke in the vertebro-basilar artery territory, which involves cerebellum and the brainstem, will be similar, which I mentioned. And if patients notice any of these symptoms, they should consult a neurologist or rush to a hospital where brain scanning facility is there, so that it can be diagnosed and treatment can be started at the earliest. There are two or three things we can mention here, those at risk. Number one is the advancing age. So people who are, say, in 20s and 30s, they have a much lower risk than those who are in 40s, 50s, and 60s. So age is the biggest risk factor, and we cannot change that. So that is called as non-modifiable risk factor. Second is the genetics. So anyone who has a family history of stroke, the risk of stroke is more in them. So these two are the non-modifiable risk factors. We cannot change the family history, we cannot change the age. Regarding the acquired risk factors or modifiable risk factors, in that the commonest things are high BP, high sugar, high cholesterol, and then the collagen disease also it's more common in younger women, what is called as autoimmune diseases. So they are antibodies which affect various tissues, and one of the tissues that can get affected are the blood vessels of the brain. So if the collagen disease affects the brain blood vessels, what is called as vasculitis or collagen vascular disease. So this is not very common condition, but women who have this, they already have mild narrowing of the blood vessels. So they also will be at a higher risk. And nowadays we should not forget we are in the post-COVID period, and COVID also has affected blood vessels, and it leads to more viscosity and chances of clotting in the brain veins or arteries. So people who had COVID infection in the, say, last 1 year or so, they are also at a higher risk of getting these brain strokes.
The Hyderabad patient recovered after medical treatment and physiotherapy. But just how fatal is the beauty parlour stroke syndrome?
So if the diagnosis is made early, in the early phase, and the treatment is started, it is not fatal. Most patients do recover. The problem comes if the stroke is severe and it takes little time for the patients to reach hospital or seek the neurologist consultation. Then the death can happen, but deaths are usually less than 10% of all cases. So about say 60 or 70% people will have milder strokes, and they recover with medical treatment and physiotherapy. About 20% may have they recover, but they have disability, mild to moderate disability, and death rate is only about less than 10% in those who are treated. Those who are not treated and they have severe strokes, then death and disability rates are higher.
Prevention, as they say, is better than cure. So what can you do to ensure that you don't get a stroke while you get a hair wash at the salon?
If we are going for a hair wash, then try and make sure that the necks are not so hyperextended. So if we have to extend, then not more than 20 degrees has been recommended. So that doesn't put too much of strain on the vertebral arteries. If it can be done in the sitting posture or little reclining posture with support of the chair or support of a towel, it's even better. And the second thing is to look at the duration. So if it is for, say, shorter time duration of 15 or 20 minutes when the hair is being washed, that is fine. Maybe for the drying, they can acquire sitting posture when the neck is not extended too much. So basically, we have to avoid hyperextending the neck too much, and that is the best thing to do.
I'll admit, all of this sounds absolutely scary. But should you worry about getting a stroke while you're getting your hair washed, or avoid going to the parlour or barber altogether? Absolutely not. Just be aware of your risks and try to prevent it. And if you experience any of the symptoms, do go to the hospital and consult with a medical expert. Before you move on to another video, a quick reminder to support our journalism. You can do so by becoming a member of the News Minute, and also subscribe to our YouTube channel. And as always, if you like this video, hit the like button and share this video with your friends.